US health authorities are warning that 10 African countries are at risk from the Ebola epidemic. Officials have confirmed more cases in Uganda. Some are linked to the outbreak in the Democratic Republic of the Congo, where dozens of patients are infected and several have died. The World Health Organization has raised the risk there to very high. But there may be hope on the horizon. British scientists say a vaccine for this Ebola variant could be ready for testing in the next few months.
The latest Ebola cases in Uganda include the driver of a vehicle that transported the country's first patient, a Congolese man, a health worker who treated him, and another person who had entered Uganda from the neighbouring Democratic Republic of the Congo. The World Health Organization says there are already over 80 confirmed cases in Congo and several confirmed deaths. But authorities think the real number may be much higher, with more than 700 showing potential symptoms and over 150 deaths possibly caused by the virus. The Bundibugyo strain behind the current outbreak is rare and may have been circulating unidentified for some time. It kills around a third of those infected, and unlike for the more common Zaire strain, there is currently no vaccine. It typically takes between 5 and 10 years to develop a vaccine, but scientists at the UK's Oxford University are expediting the process. They already have a so-called candidate vaccine that's almost ready for trials.
What we are doing is using the same technology that we used for the COVID vaccine to help make a vaccine against Bundibugyo. So we're going as quickly and as safely as we can. We've got some great partners globally, the Serum Institute of India, our on-site manufacturing facility, CBF. So we are getting the materials that we need to make the vaccine at scale to the Serum Institute quickly. And we're hoping, if everything goes well, that we would have a vaccine that could be tested in 2 to 3 months.
Professor Lam and her team say they hope the outbreak will be brought under control quickly without their help. Nevertheless, they're working flat out to have a vaccine ready soon to help stem the spread and prevent future outbreaks.
Esther Sterk of Doctors Without Borders gave me this update from Bunia in the Democratic Republic of the Congo, the epicenter of the latest outbreak.
Yeah, so the situation is very concerning. It's now a bit longer than 1 week that the Ebola outbreak has been confirmed. So probably the transmission has been going on already for quite a while, probably weeks, maybe even months, probably. So what we see currently is that there have been already a lot of cases. Currently, every day there are new cases. There are also new deaths, and there are also new cases coming from new areas. What we also see is that at the moment there's not enough areas where patients can be isolated, not enough treatment centers. There's not enough medical staff and logistical staff on the ground. There's not enough protective material on the ground. And there is a lack of diagnostic capacity. So for now we are having a lot of suspected patients for which a sample can be taken, but then there's not enough diagnostic capacity right now to be able to confirm the diagnostics in these patients. And this is complicating a lot the situation, yes.
Yeah, I mean, you mentioned, we've heard that before, of course, that the infection has been around for quite some time before it was really detected, the first cases detected. So how easy or how difficult is it to recognize that someone is infected? What are the symptoms to watch out for?
Yeah, so what is very important, so if somebody has been in contact with somebody else with the Bundibugyo virus, with Ebola disease, then that person could have been infected as well. So if somebody has a history of being in contact with somebody who was sick, severely sick, or who died, and if that person itself also will develop symptoms, then you can speak about a suspected patient who would need to have testing. Then for the Ebola disease, the symptoms always start with fever, and then people get more and more symptoms over the days. In the beginning, it can be like diarrhea, vomiting, pain in the muscles, and then part of the people will get more severe symptoms, like more severe vomiting. They will have dehydration, and some people will have bleeding and multiple organ failure.